Okay, so now you're ready to write a culturally competent intervention. Before you start writing, there are some additional learning strategies that you should keep in mind depending on the demographics of your audience. For instance, for children, you want to make sure to keep your messages short, clear, and simple. Relate the message to the child's interest and make practical, immediate suggestions. Children don't feel a perceived threat for some risk of disease in the future. That's way too long term. Instead, a better strategy with children is to focus your message on the immediate interests and goals, the immediate benefits that they're going to receive from doing something. For adolescents, as you know, social norms, peer pressure, and other social constructs that influence behavior become critically important. So you want to focus your messages there. When working with pregnant women, you should anticipate anxiety. Pregnant women can be difficult because there are many ways to eat, and they are very concerned about eating exactly the right types and quantities of food, especially when you get people who are facing gestational diabetes. In my private practice, I run a group for women with gestational diabetes, and well, it's really for all pregnant women, but most frequently I get women who have gestational diabetes, and they fear that they have done something wrong and that whatever they have done wrong in their diet is going to cause a lifetime of risk and disease for their child. So they want to know, exactly what they should and shouldn't do and how much of this they should be eating. And as we know, as dietitians, that it's not an exact science in that way. So you always want to, when working with pregnant women, calm their anxieties and emphasize positive messages. And keep in mind when working with both adults and older adults that they really need personalized, individualized care. Many of the techniques that you'll learn or have learned in a counseling class. When developing nutrition education, keep in mind that we all have different motivations for doing or not doing something, and trying to develop inclusive messages that translates across audiences will help you better target your interventions for adults and older adults. And specifically, when working with children, there are three domains of learning that your nutrition education should focus on. And these kind of correlate with what we've talked about in behavioral theory. So the affective domain addresses factors that motivate children. So this is the why to do something. The cognitive domain presents children with the how to do something. And the behavioral domain is really helping children build new skills, which is really also part of the how to do something. When working with adults, you need to keep these three domains in mind, but you also need to think about incorporating a variety of teaching methods that expand on these three domains of learning. And there are three important principles to consider when you're designing nutrition education for adults. First, you want to make the nutrition education personal. You can do this through individual activities, reflection, having people discuss their own experiences about something. Either way, the nutrition education needs to be personal to their own experience. You want to connect their past behaviors with their current concerns. So sometimes people aren't always aware of the behaviors that they do that contribute or don't contribute to a certain risk of a disease or their current behavioral patterns. But adults have the ability to be reflective and to make connections about what has and hasn't worked for them, and facilitating those connections will make your nutrition education more effective. And then third, you should always consider the learning style and motivation of your particular audience. This goes back to ensuring that your materials are culturally relevant, but also that you're using language that's appropriate for the education level of your group. For instance, a good rule of thumb when you're working with a low literate population, or maybe a group where English is not the primary language, then you really want to try to keep materials to a sixth grade reading level. And we know that for adults, there are many more factors to food choices and to learning than for children. You want your nutrition education intervention or program to be in a comfortable, convenient setting, to cover appropriate topics in a respectful way, and to encourage everyone to participate in the learning process. Obviously, you see me doing this in class all the time. I'm trying to get everybody to participate because we learn best when reading, hearing, and applying new information. So you want to be sure to include each of those opportunities, reading something, hearing something, and applying new information to an activity in order to make your sessions more effective. So the nutrition education plan that you summarize in your logic model is actually much more complex when it's written out on paper. And in this course, the guide for the document that you'll create your workshops with is obviously the design framework. So in this session, we're going to focus on developing these lesson plans and nutrition messages that you'll use for steps 4 and 5. Before you start actually writing your lesson plans, though, you have to keep in mind that the most important thing to remember is that your education should be focused on active learning. I think we've all had lecture classes where we've been maybe falling asleep or a little bit distracted because there's so little engagement that it's difficult to stay on task. And then when reviewing what you quote unquote learned during that class, it turns out you didn't retain much information at all. But in classes where students are engaged and participating in the lesson, it's much more likely that students will remember the material and retain the information. Active learning is, at minimum, participating in a discussion, but even more than that, it's giving learners actual experiences doing something. In nutrition education, that could be having participants prepare and taste recipes, or actually reading and deciphering nutrition fact labels. Therefore, in your nutrition education sessions, you want to include as many active learning experiences as possible in order to make it more likely that your workshop participants or students will learn and remember what you teach, and you don't want them to be falling asleep. This slide is based on studies that have been done to see how much information people retain 2 weeks after an intervention. So on the left side of the slide, you'll see that we remember 10% of what we read, 20% of what we hear, 30% of what we see, all the way up to 90% of what we say and do. So there are different strategies that you can use in your sessions to get people to both say and do the things that you want them to remember, thus making it more likely that they are going to achieve your goals and objectives for the sessions. And you also need to keep your messages really clear and simple. What you want participants to take away from your session should be simple, and any activities that you do should reinforce the knowledge and build their skills to apply that single piece of information. State your educational objectives in terms of the end product. So what do you want them to be able to do? In other words, you would want an objective to read, students will be able to ... fill in the blank. For instance, students will be able to identify the serving size, calories, and total grams of fat on a nutrition fact label, rather than students will practice how to read different aspects of a nutrition fact label. In other words, you don't want them to just be able to read the different aspects, you want them to identify the most important parts. Focus on what you want in the end. And lastly, you want to keep your educational objectives, like your messages, simple and straightforward. In other words, make them measurable. You might be wondering exactly what I mean when I say that your objectives should be measurable. Although you probably remember from the previous lectures that you should always use the SMART criteria for goals and objectives. That is, just to review, they should be specific, measurable, attainable, relevant, and time-bound. In this slide, we can look at exactly how you write them for nutrition education. So let's take a look at a few examples of objectives here that are written poorly and rewritten well, and consider how measurable and attainable they are. So first, you never want to write the teacher or educator, you, into the objective. As in, what you don't want to do is write, educator will demonstrate to students how to read a label. That's neither learner-focused nor measurable in any significant way. Rather, your objective should state, at the end of the demonstration, students will be able to identify the serving size on the food label. Notice what the slide said and what I've said are a little bit different. The slide says students are expected to, whereas an even better phrase would be students will be able to. It's more active wording. If students will be able to, then you can measure if they're able to or not. So rule number 2, you want to use clear verbs for what participants will be able to do. You can start every objective with the same stem. I should say that. Always start with students will be able to ... So then you want to use active verbs after that. Students will be able to list, define, identify, or insert any other verb there. If you're going to use something like list, then you have to quantify how many things students will have to list. In other words, your objective would be students will be able to list 5 benefits of eating fruits and vegetables. Or the example on the slide is that students will be able to identify 3 benefits of breastfeeding. That is both measurable and attainable in a short lesson span. Number 3, about the specificity of verbs, you want to use only measurable verbs. Using phrases like gain knowledge of, develop an appreciation for, or improve attitudes towards are nearly impossible to measure. After you write each objective, reread it and ask yourself, can I evaluate this objectively? How would I do that? So you want to avoid terms such as increase, gain, improve, add, or develop, because those are very, very difficult to measure. And then lastly, rule number 4, don't make your objectives double-barreled. If you aren't familiar with the term, double-barreled means having 2 parts. So an example of a double-barreled objective is stated here. Understands how to count carbohydrate grams and applies the knowledge effectively. Well, somebody might be able to understand how to count carbohydrate grams, but they might not apply the knowledge effectively. So in this case, this would be something that's very, very difficult to measure. If a student can only do half of this statement, have you been successful or not? Another example might be students will be able to identify 5 benefits and 5 barriers to eating more fruits and vegetables. Obviously, if they can identify 5 benefits but not 5 barriers, then have you achieved this or not? Instead, you want to separate the 2 parts into 2 different objectives. Although, I just want to note, to go back to the well-stated objective on this slide, aka upon completion of the class, students will be able to apply the knowledge of counting carbohydrates effectively. This is also a poorly written objective because the second part of this is not measurable. Apply the knowledge of counting carbohydrates effectively. Since you're not defining what effectively means, then I don't know how to measure that. In other words, this quote-unquote well-stated objective still needs a little bit revision for me. After you've written your behavioral goal and your educational objectives, and since you already know what behavior theory you're going to be using, you can begin to write your lesson plans. You already have the format laid out right for you in the design workbook. The matrix style, which is a brief overview, and then the narrative style, which provides a lot of detail. A matrix style lesson and a narrative style lesson both contain all of the information that you see written here. It states the behavior change goal, the general objectives, and then something about the body of the lesson, which includes the information that you'll disseminate, the activities that you'll do, and then how you'll evaluate it. In the design workbook, this is an example of the matrix style format, which you'll complete first to outline your lesson. Notice here that the first column is something that we haven't talked about yet. This is the 4 E's. The 4 E's are something that you can use to plan out your lessons just a little bit more effectively. So you want to first excite people, gain their attention. This could be starting with raising awareness around the risks and benefits of something, or if you have ongoing lessons, then you might want to review and reflect on past lessons. Then you want to explain. You want to present new material and focus on why your participants should take action. So the explaining part is part of the why to information or motivational information. We also talked about this in terms of the 3 domains of learning as the affective domain. So you want to provide guidance and practice and focus on how your participants can take action. This is the expanding part of it. This builds on their knowledge and their cognitive skills. Finally, you want to exit. So you want to have people apply this information and you want to close your session. The next column in the matrix format includes the determinants, which are based on the behavior change theory that you select. The strategy column are broad statements about the procedures that you plan to use. And then there are specific objectives that we've already discussed today how to write. Then the last column is the activities column. So you'll describe exactly what you'll be doing with participants right here. And the activities is where you can get creative. One example of an activity may be breaking into small groups to examine the nutrition fact label of packaged snacks, or it could be preparing foods. There are many different kinds of activities that you could do based on your specific objectives. And obviously the activities that you write will accomplish the specific objectives that you have listed. So, in general, when designing nutrition messages for your workshop, you want the takeaway for participants to be very simple. You will have maybe changed their attitudes about it or built their skills and given them some how-to knowledge and information. But really, you want the actual message that they're leaving with to be very, very simple. No one wants to sift through information to get to the heart of the issue. When they do focus groups about this, then we learn that people really just want messages that give it to them straight, aka it doesn't use technical or complicated language, that are simple and fun. In other words, they make the takeaway something that's really easy to do. And we've discussed this a little bit in previous lectures. Like we said that you can't expect somebody to go from having 1 cup of fruits and vegetables to 5 cups of fruits and vegetables per day. You need to make the goals small and realistic. And consumers also want messages that explain why to do something, not just how to do something. They want the motivation piece to be clear, so you should never skip over it in your lessons. People also say that they want consistent, empowering messages. So they want choice and they want to feel like they have some power over their behavior and how they can implement what you've taught them. So you'll keep all of these things in mind as you move ahead with step 5 of your workbook. There's a PDF in the materials folder for today that I'd like you to review. It provides a little bit of an example and it'll explain a little bit more about step 5. If you have any questions, please email me or post the question to your discussion boards or, whatever you need to do. And for the future, keep in mind that when developing new interventions, it's all about being creative and innovative. Why would funders or grantors give you money for a program that's been tried many times before? New ways to engage people are always encouraged. Be creative, as long as the program stays within the guidelines of your health behavior change theory of choice. And next week, we'll talk a little bit more about creativity in nutrition program messaging and how to develop social marketing campaigns for a broader audience. So today we've covered how to develop specific nutrition interventions for small audiences. And next week, we'll talk about the bigger picture, how to design public health interventions.